Okay, celiac disease is often described by the patient as lactose intolerance or gluten sensitivity. It is an immune reaction to gluten, which is a protein found in wheat and related grains. This immune reaction will cause atrophy and villi of small intestine. So the main symptoms are abdominal pain, indigestion, diarrhea, patient may be nauseated or vomit, but importantly, malabsorption. Because villi are important to increase the surface area of small intestine for efficient absorption of nutrition, and this is a structure that is destroyed by the inflammation caused by the immune reaction to gluten in celiac disease patients, malabsorption is usually seen. And these are the image of healthy individual of endoscopy and H&E stain histology slide. And you can appreciate the villi and the rough surface texture of the small intestine. However, in a patient with celiac disease, you may see that their surface texture is very smooth and atrophy is seen in the villi. Now, the prevalence of celiac disease is quite high in Caucasian population, 1 to 2%, and many are thought to be undiagnosed. So if you have 100 Caucasian patients walking into your clinic, you'll at least have 1 or 2 patients with celiac disease, and they may not even know it. There are 2 peaks of age which this condition may be diagnosed, 8 to 12 months old and 3rd and 4th decade of life. The etiology of this condition is still unknown, but genetic component is thought to be one of the main factors. Because of the malabsorption, you may see variety of oral manifestation. These are the oral manifestation observed in 200 diagnosed celiac disease patients. You may see enamel defects, maybe from a malabsorption from childhood or baby. And oral soft tissue lesion is commonly seen, such as aphthous ulcers or aspecific atrophic glossitis or geographic tongue. So if you see these symptoms with unspecified cause in a relatively young Caucasian, you may want to check with them if they have gluten sensitivity or GI symptoms when they eat a lot of gluten-containing foods. And if they said yes, you may want to refer the patient out for a further evaluation of celiac disease. Diagnosis of celiac disease is made by positive finding in one of these serologic markers and confirmed by biopsy of small intestine showing atrophic change. But this biopsy should be done before gluten-free diet because the atrophic change is thought to be reversible change. The serologic markers that they may want to see is anti-TTG, EMA, and anti-DGP, and these all have high sensitivity and specificity. Now, biopsy is an invasive procedure, and for an alternative, confocal endomicroscopy is commonly used these days instead of biopsy. And this procedure also has fairly high sensitivity and specificity as well. The only valid treatment now for celiac disease is to put the patient on gluten-free diet. There are many websites providing information to the patient of what they can eat and they cannot eat. Also, they provide variety of recipes so they can still enjoy eating. These are some of the examples of gluten-containing foods. And in the United States, because gluten sensitivity or celiac disease is commonly seen, the gluten-free version of these foods are also available. Okay, thank you for listening to my presentation.